Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Vida Reed. Vida graduated from George Mason University in 1995. She has worked for many years as a research nurse in the area of women's health, heart disease, and diabetes. She became a certified diabetes educator in 2001. She is a member of the American Association of Diabetes Educators and the American Diabetes Association. Vida has been at Washington Hospital since 2006, serving as our diabetes program coordinator.
So a couple of vocabulary words to kind of familiarize you with things. Glucose is a simple sugar found in the blood. It fuels all of the body's cells and it allows them to function, without which they can't function. Hypoglycemia, hypo is a low level of glucose in the bloodstream. Quick-acting glucose refers to sources of simple sugars that raise the blood sugar levels very quickly, like juice, regular soda, glucose tablets or gels, or even some hard candies. And we'll talk more about what those things are as we go forward. And of course, glucose tablets or gels, they're special products that deliver a pre-measured amount of pure glucose or pure sugar. They are a fast-acting form of glucose and they're used to counteract the signs and symptoms and effects of hypoglycemia. Carbohydrates are a source of energy for the body which raises the blood sugar levels. And glucagon is a hormone that is given by injection and it raises the level of glucose in the blood. So when some people have hypoglycemia, they may need glucagon to raise their blood sugar levels. So what's there to know about hypoglycemia? Well, it's responsible in 2011 for 282,000 emergency room visits for adults over 18, often listed as the first diagnosis and diabetes being the second when people are admitted for hypoglycemia through our emergency room. So it's kind of a big deal, right? It's a pretty big deal. Hypoglycemia, as I said, is a low blood glucose level. The symptoms can be very sudden. Usually they start out mild, but they progress if not treated. They may even progress to more serious symptoms like unconsciousness and seizure if not treated, and can result in brain damage or death when left untreated. So, what is there to know about hypoglycemia? Well, you want to recognize the symptoms early and intervene to prevent an emergency. You are at greatest immediate danger when it's not treated. It's not always preventable, and it can impair cognitive and motor function. Hypoglycemia is not, the episode itself is not an urgent thing, but it can become an emergency. And what you want to do is prevent it from becoming an emergency. Most hypoglycemic episodes are mild, and they tend to respond to quick-acting or fast-acting sugars very quickly. So recognizing the symptoms and having access to treatment is important when you're having a hypoglycemic episode or you are at risk for hypoglycemia. You want to have treatment always around for you. When you have hypoglycemia, one of the things that can happen is that you might not recognize the symptoms. So we're going to talk about what those symptoms are when you have hypoglycemia to prevent the more serious emergency condition that can arise from it. So what causes hypoglycemia? What makes your blood sugars drop too low? Well, whenever there is too much insulin in the body for the amount of glucose, there's an imbalance and you can end up with hypoglycemia. The main reasons for that is too much insulin. You gave yourself too much insulin, perhaps. That's a possibility. And sometimes it's not so much that you gave yourself too much insulin. You could have given yourself the wrong insulin. Like one type of insulin might have been ordered to give you 40 units, and then another type of insulin might have been said to give 10 units, but you mixed them up. So you got 40 of the 10. So too much insulin on board, right? Too little food has been eaten, or you've delayed your meal, or you've skipped your meal. Those are some of the things that can cause hypoglycemia. Extra activity, more exercise than you normally would have had. And that could be, when you think of activity or exercise, sometimes you think you're walking or going to the gym or something like that, but activity could be that you decided to vacuum the floor. It wasn't planned, but you're gonna vacuum the floor now. So too much activity, unanticipated activity. In addition, illness can cause your blood sugars to drop too low. Medications, not just insulin, but some of the diabetes medications that are used to treat diabetes can cause your blood sugars to drop too low. Not just some of the medications, but also not just diabetes medications, but other kind of medications too can cause your blood sugars to drop too low. One of those medications is beta blockers. If you take a beta blockers are things like metoprolol, Lopressor. They can contribute to low blood sugar as well. And stress can cause your blood sugars to drop too low. And drinking alcohol. When you drink alcohol without eating, it can cause your blood sugars to drop. So whenever you're going to have alcohol, you always want to make sure you're having it with food to prevent you from having hypoglycemia. And we'll talk about some other ways to prevent hypoglycemia too as we go forward. So what about the severity of diabetes, of hypoglycemia? We oftentimes classify hypoglycemia according to the symptoms. What may be mild for one person may be severe for another person if it impairs them to a point where they can't treat it. So with mild hypoglycemia, we usually say it's less than 70, and the person who's experiencing it, they recognize the symptoms and they can treat themselves. They can get that fast-acting sugar treatment themselves without the assistance of others. Moderate hypoglycemia occurs when you may be aware of it, but you may not be able to treat yourself. You might require somebody else to help you to treat it. In severe hypoglycemia, oftentimes a person may have lost consciousness or unable to recognize or treat the hypoglycemic episode that they're experiencing. So when we define severe hypoglycemia, we typically are looking at the point when you can't independently treat yourself. It's dangerous and it should be avoided, right? Not because hypoglycemia itself is fatal. That's very, very rare, I have to tell you. Hypoglycemia is very rare in terms of it being fatalistic. But what happens is the situation becomes dangerous for the person experiencing it. So one of the biggest dangers we worry about with hypoglycemia is motor vehicle accidents. If you're driving and you have a hypoglycemic episode and you are not quite yourself, you could have a car accident. If you hurt yourself, probably not as big a deal as if you hurt someone else, right? Cause a major accident. Passing out at the wheel, swerving into oncoming traffic, hitting a tree, running stop signs. Sometimes people are seriously injured when they fall down the stairs. If they lose, remember, it affects your motor skills. So if you're walking down the stairs or walking up the stairs or not on stairs at all, but falling and injuring yourself from a hypoglycemic episode. So it's really important to avoid hypoglycemia to prevent injury, to prevent accidents, and also to prevent damage that may occur to the brain as a result of having prolonged and repeated episodes of hypoglycemia. So what are some of the mild to moderate symptoms of hypoglycemia? Some of you guys, somebody's had hypoglycemia here before, right? So do you recognize any of these symptoms? Trembling, rapid heart rate, sweaty, pale skin, cold, clammy skin, dizziness, headache. Your heart rate can start to get a little fast. You can feel your heart beating, palpitations. Anxiety, change in personality, you get a little bit more irritable. It's really funny. Symptoms of hypoglycemia can vary from person to person, and even in one person, they can change over time, the symptoms that you have as a result of being exposed to hypoglycemia. So mild hypoglycemia is usually, it can be treated very easily and effectively, and so you want to make sure you recognize the symptoms. But if not treated, it can progress to more severe symptoms, right? If you don't treat it. And when you're thinking about the more severe symptoms of hypoglycemia, We call them the neuroglycopenia symptoms. One of the brain's main sources of energy is glucose. So when the body is lacking the presence of glucose because of hypoglycemia, the brain takes a real big hit. So you start to have things like difficulty concentrating, increased irritability, your vision can change, you might even have difficulty hearing, speech can slur, like I just did. Poor judgment and confusion. You can also become a little bit more agitated as well. Dizzy, unsteady gait, fatigue, nightmares, emotions can get out of whack. And ultimately you can have a loss of consciousness or seizures can occur when hypoglycemia is occurring. So neuroglycemic symptoms is a medical term that refers to the shortage of glucose in the brain, usually due to hypoglycemia, altering the brain's function and your behavior. And as I said, glucose is the brain's primary fuel source, and that's why the brain feels the majority of the impact from hypoglycemia. Other cells of the body can pull energy from other places, right? So when you're having hypoglycemia, they can pull energy from other sources, but the brain can't really do that. That's why it takes a really big hit when you have hypoglycemia. So what do you do when you have hypoglycemia? Well, you want to definitely treat it as quickly as possible. So recognizing the symptoms is the first step to treating it. So when you have hypoglycemia, generally you want to check your blood sugars if you have a meter available. So check your blood sugars with your meter. And we define hypoglycemia as a blood sugar less than 70. And remember, we talk about severity is depending upon how you're affected by it, right? Your ability to self-care, to take care of yourself. So blood sugar is less than 70, and you recognize that you're having symptoms, you check your blood sugar, and you know what you need to do to treat it. So that would probably be considered mild hypoglycemia, right? So, but if you don't have your meter, or you don't have it with you, it's at home, it's in another room, it's downstairs, and you don't want to take a chance and fall, it's good to just go on and treat it. It's okay to go on and treat the hypoglycemic episode if you are having, if you don't have a meter to check your blood sugar. So when you're in doubt, you always want to treat so that you want to avoid the progression to a more serious situation. When treating hypoglycemia, you want to consider the rule of 15 to treat it, and we'll talk about what that is. But never get in a car if you think you're having a hypoglycemic episode. You don't want to drive when you're having it. Don't operate heavy equipment. Don't try to cut the cucumbers. You want to avoid things where you might injure yourself if you're having a hypoglycemic episode. So those are things that are important to remember. And on the next slide, we're going to talk about what is the rule of 15? Have anybody heard the rule of 15 before? Well, the rule of 15 refers to, it's just a quick way to think about how to treat hypoglycemia. So you have symptoms, you recognize the symptoms, you check your blood sugar, and it is in fact hypoglycemic, it's less than 70. Or you're having symptoms and you feel like you need to treat them. You want to treat it with 15 grams of a fast-acting sugar, of a quick sugar. That's the first 15. Treated with 15 grams of a fast-acting carb. That's the first thing you want to do. And sometimes people, they make decisions to treat it with a little less carb, because if you're treating it with the glucose tablets, most of the time the glucose tablets, it takes 3 of them, depending upon the brand, 3 to 4 of them to equal 15 grams. One of them is like 2 to 3 grams of carb. So it takes 3 or 4 of those to equal the 15 grams of carb. And after you've treated it with the 15 grams of carb, you stop what you're doing, you sit down and you wait 15 minutes from the time you treated it, and you recheck again. So that's the second 15. So this is why we call it the rule of 15. 15 grams of a fast-acting sugar, and wait 15 minutes, recheck the blood sugar. Now, if the blood sugar is above 70, when you recheck it, then you want to go on and have a snack or have a meal if you've delayed your meal. But here are some samples of some of the quick-acting carbs that you can take to treat a hypoglycemic episode. And this is when we give you permission to have sugar. It's a treatment, not a treat. So you want to think of it as medicine, Any of these quick-acting glucoses can be used to treat it. Sometimes you know what works best for you, what's worked in the past. You want to keep that around. 4 ounces of fruit juice. You can buy those little paper cartons of juice. They're usually equal to exactly 15 grams of carb, and they can be stored in or out of the refrigerator. They don't spoil when they're not refrigerated. When you open up a bottle of juice at home, it does go bad if you don't drink it, and we don't recommend drinking juice. We actually prefer you to have fruit. But in this case, you want to have the juice because it's going to be quick acting. So you can buy those little juice containers, and they're 1 serving. You can also treat it with glucose tablets or glucose gel, depending upon your preference. Now, the 4 to 6 small hard candies is kind of iffy. As you get older, you want to worry about breaking your teeth, right? If you chew down on some of those hard candies. So if you choose hard candies, you want to get something that's really soft, like those soft peppermints or the Smarties, the little Smarties that they give out, I think, around Easter time. Peeps, I've seen people use those too. But you want to figure out what works for you. 1 to 2 tablespoons of honey, 6 ounces, about a half a can of regular soda. This is the only time I recommend regular soda. Or 3 teaspoons of table sugar. And sometimes with kids, they'll eat that cake made, that cake decoration. You got to get creative when you're trying to treat children who are having low blood sugar. So that's why that's on there. So those are some of the things that you would use to treat a low blood sugar value. If you use this table sugar, oftentimes you want to dissolve it in some water. Rather than just trying to take it directly, you want to dissolve it in some water. If untreated, the symptoms can surely progress to more serious conditions like you're having convulsions or seizures, loss of consciousness, inability to swallow. Those kind of things can happen if it's untreated. If you are having a severe hypoglycemic episode, oftentimes you need someone else to take care of you now. You can't treat yourself anymore. And what you're typically treated with is what's called glucagon. You want to inject glucagon. Glucagon is a hormone that triggers the release of sugar from your liver. It forces sugar out of the liver. One of the things that the pancreas does, we talk a lot about the pancreas and how it works to control blood sugar. And have you guys heard the word beta cells before? The beta cells in the pancreas make the hormone called insulin. Well, there are other cells in the pancreas, are alpha cells. The alpha cells actually make a hormone called glucagon. And glucagon triggers the release of sugar from the liver. So it's a balancing act to keep your blood sugars stable. So when you're having a severe hypoglycemic episode, the pancreas, the pancreas isn't able to make those alpha cells to trigger that production of sugar from the liver, so you inject the glucagon. If you ever have to give someone glucagon, it's more important that your family members or caregiver knows how to use glucagon rather than you, because it's usually used when you're unconscious, right? But if you ever have to give someone glucagon, there's an app that you can download on your phone. It's called Glucagon. And it's by Lilly. It's a product made by Lilly. If you download that app, it actually it teaches you how to use glucagon. And if you suffer from hypoglycemia repeatedly, or if you've ever lost consciousness from hypoglycemia, you should have a prescription for glucagon in your home. It typically lasts about a year or 2 before it expires, but you should have a prescription for glucagon and have it in your home, and someone who takes care of you should know how to use it. But if you ever do give glucagon, you always want to understand one of the first things that happens once you give it to them is they're going to vomit. After they wake up, they're going to vomit. So you want to make sure they're laying on their side so they don't choke on their vomit now. Make sure they're laying on their side and keep their chin and their airway open if you have to give them glucagon. If someone can't swallow or can't follow instructions to swallow, you don't want to put anything in their mouth, because now they can aspirate or choke on that. So that's when you want to use glucagon. If you ever have to give glucagon, or someone who has diabetes loses consciousness and you can't give them anything to eat, you should call 911. So if you lose glucagon or the person can't eat anything, you want to call 911. And once you want to use the glucagon first, then call 911. They should respond within 10 to 20 minutes, and just keep them comfortable until help arrives. But oftentimes, once they have glucagon, they will vomit. So you want to make sure they don't choke on their vomit, right? So we talked about the symptoms of hypoglycemia, how to recognize them, how to treat hypoglycemia. I want to briefly, before I talk about prevention, just go over recovery a little bit more. We talked about the rule of 15. So we talked about the causes of hypoglycemia being maybe a delayed or skipped meal, right? So if it's time for a meal after you've treated yourself with the rule of 15, I would go on and have that meal after the blood sugar has been risen. You know, a lot of times what patients tell me they'll do, if they feel hypoglycemic, then they'll eat. But you want to treat the low blood sugar, bring your blood sugar back to its baseline level, and then it's time to have a meal if it's time for a meal. And if it's not time for a meal, you want to have a healthy snack. And choosing what a healthy snack is something you can make, a decision you can make with your dietitian. So, preventing hypoglycemia. Well, we know that the onset and progression of hypoglycemia can happen very quickly. So, you want to know how to prevent it to avoid that feeling of insecurity and putting your health and things at risk. Always keep a fast-acting sugar with you. You should always have one of you if you've experienced hypoglycemia in the past, or if you take insulin, or if you take other medications that lower the blood sugar by stimulating the release of insulin. You should always have a quick-acting sugar source with you. Treat at the onset of the symptoms. Don't wait. The symptoms won't go away if you don't treat them. They're just going to get worse. So you want to treat when you have it. You want to make sure that you're dosing your insulin properly. If it was, maybe the insulin that's causing it. With insulin treatment, you want to make sure that, a lot of times as people get older, they become more picky eaters about what they eat. They'll sit down with the turkey sandwich and they'll look at it and take a couple of bites and they're done. But they've already had their medicine perhaps, right? So if you've gotten to the place where you're not really always sure how much you're going to eat when you sit down to eat, you want to talk to your doctor about a different plan for maybe how to dose your medications, maybe taking them after you eat, once you've decided how much you're going to eat. You want to get nutrition information from your diabetes dietitian. And as I said, the doctor may specify some after meal dosing for some of your medicines. For physical activity and insulin and eating and checking your blood sugars, you want to stay on schedule with those things. It's really important to follow a schedule when you are treating diabetes. Timing is a very important element in diabetes management. Timing is a very important element. So you want to eat on time, take your insulin on time, check your blood glucose on time, and do your physical activity on time. So that's kind of it for hypoglycemia. Thank you for coming out tonight. I appreciate it.